This is gonna hurt. It's time for the Suffering Podcast.
Our bodies have an expiration date, and from the moment we are born, the clock starts ticking. Events happen in our lives that leave us with everlasting marks that we would soon like to forget. Whether it's our vanity, hubris, self-esteem, or quality of life, we're conscious of how we're presented to the world, always wishing to show the best of us, the inner beauty projected outward. It is often the most beautiful people who have the most scars. What if there was a magic wand that could erase reminders of the scars that damage our soul? With the flick of a wrist, all our pain is taken away and replaced with peace and fond memories. I'm Kevin Donaldson here with Mike Failace, and on this episode of the Suffering Podcast, we sit down with Dr. Stephanie Cohen to discuss the suffering of a plastic surgeon. Dr. Cohen helps repair the lasting scars and help breathe new life into people, maybe leaving some of the old scars behind. Dr. Cohen, thank you so much for joining us.
Sure, my pleasure.
Doc, before we get into it, could you do anything with this?
I knew that was coming at least once.
I know. I'm sick of looking at this every week.
You know, my primary subject is my husband, and he always asks, "What can you do with my nose?" And I say, "Absolutely nothing. There's nothing I could do to help it." It's got the biggest nostrils you ever see.
He picks his nose like this.
See, on the other hand, I can't get my finger up my nostril. Could you give me bigger nostrils then?
You lucky I can't hit your elbow to go right up and stab your brain.
Kevin, you're beautiful.
Before
It's
we
the
get
first time he's ever heard that, but go ahead.
Before we get into anything, we have to throw a shout out to Toyota of Hackensack. We buy our cars from Toyota of Hackensack. That's because we don't trust anybody, and we do trust them. So go to toyotaofhackensack.com, let them find you a car. And when you're driving home in your new Toyota, go to Frontline Cigars. There's nothing better to celebrate than a Frontline Cigar. It's a Chicago-based cigar company run by two police officers, a 15 and a 30-year veteran. They really do their best in order to help the cigar community gel together and be more family-oriented. So go buy a Toyota and enjoy them with your new Frontline cigar.
If you get plastic surgery, could you have a cigar right after it to celebrate your plastic surgery?
That would be the worst thing you could do.
Didn't you ever see that Seinfeld episode where Kramer was smoking all those cigars? His face looked like a catcher's mitt?
Oh, I thought you were going to talk about the Junior Mint episode.
Oh, that's another good one. That's another good surgery one. Dr. Cohen, we take questions from our audience every week. This week's social media question comes from Kelly, and it says, what advice would you give your younger self? So I'm going to pass this one off to you since you're our guest.
Oh, boy, it started off with a really hard one.
We don't make it easy here.
The little Dr. Cohen walks into this room, and what would you tell her?
Boy, that's hard. It's funny. When I had this really kind of advanced feeling when I was a kid that I was going to do something like this. And I did. So there's
I was going to say, was it a lifelong dream of yours?
I think it wasn't 100% a dream. It was my dream of my father for me to be a plastic surgeon, or for me to be a surgeon, really.
To be a doctor,
to
just
be a doctor,
in general.
Mostly a surgeon. No, doctor wasn't good enough. It had to be a surgeon. My father was a gynecologist, and there was no getting out of being a surgeon. I was like, he would like whisper it to me in my crib. So it was going to be that, or it was going to be nothing. And I was actually an artist, and I was going to go to art school instead of going to medical school.
Well, you just chose a different art.
Well, exactly. So I had a high school art teacher who said, yeah, your dad really wants you to go to medical school and you're good at science. And so, you could be an artistic doctor. And
Nick, your father wasn't a gynecological surgeon,
he
was
was,
he?
yeah.
He was a surgeon?
Yeah.
He did.
Really?
He did vagoplasty.
Vagoplasty.
No, that's what a plastic surgeon does.
Vaginectomy.
That's what a plastic surgeon does.
If it says plasty at the end, that's what a plastic surgeon does.
So if you were to go back and talk to that young lady,
yeah, gosh, what would I tell her?
What would you tell her?
I would tell her, keep plugging away because it's all going to be okay in the end.
Well, because when you're younger, you can't see
out.
the long run. You can't see the picture at the light at the end of the tunnel.
Yeah.
You have to go through all that, the hard work and everything before you get there.
Yeah, there's a lot of hard work to get to plastic surgery. It's a long
I'm sure.
time. Again, I always had this sort of weird feeling that I was going to get there, and that I knew how to get there. And I was going to do it different than other people. Because, when I went into surgery, there weren't a lot of women in surgery. There were very, very few. So,
That's a whole other subject,
yeah,
female surgeon.
Yeah.
What do you think?
Oh, yeah, I never aspired to be on a podcast. I know that. And if I would have talked to my younger self, I would have said no to that. But, I just keep pushing ahead,
Yet you keep coming back.
Yeah, no kidding.
There weren't a lot of people telling me what to do or how to do it,
Yeah.
So just I always had this idea that I was going to get there, and so
just gotta figure it
myself
out.
now would say, you did it, you got there. It's actually almost harder when you get there and you're like, okay, now what do I do? Once I got there.
Was there like a feeling of accomplishment when you got there?
Yeah, it's such a long process.
Finally,
though.
just said,
It's kind of
I'm here.
weird. Yeah, because you're like, what do I do with my life now that I'm not striving to get there anymore? You have to keep working on yourself then. That's harder.
Yeah. My whole thing, you just keep pushing on. Set yourself a goal.
Is that what you would tell your younger self, other than
Yeah.
get minoxidil real early?
I mean, there was a lot of things I would tell a kid, but we are in mixed company right now, but I can't say anything.
Don't sleep with this girl, and don't go near this one. And
Stop touching that.
you're gonna go blind.
Get hairy palms.
Yeah.
No, just set your goals. Find out something that you want early in life. A lot of people, they go to college with no purpose in life.
Yeah. Oh, that's.
They're just going to go to college and
Most
say,
of them.
I'm going to go to college.
Yeah.
For
You have
what?
Exactly.
For what?
I'm going to go
Right.
and you wind up taking up space. And like I said, I went to college for a year and I realized that wasn't for me. And I said, I have at that point when I'm 18 years old, I set a goal in my life. I always said I want to be a professional football player. Then I learned I was too slow, too short, and too white. And then I always wanted to be a cop. So I set my goal on becoming a cop.
Well, there you got to adjust what your goal is sometimes.
Yeah.
Well,
exactly.
that's the adjustment part.
Sometimes
yeah.
you
That's a
hit those
big one.
crossroads.
Yeah.
Well, you had to learn. So one of the prerequisites for college, and probably the reason why you had to leave, is one of the prerequisites you had to read, and know how to read above a third grade level.
Yeah, see, I had a fourth grade level, so I was accepted into
You were
college.
accepted.
Yeah.
Okay. For me,
Here's a guy who can't get through an intro without stumbling all over himself, and he's telling me I got to read. But go ahead.
there's a reason why I read the
Yeah, I know.
intros, because there's a lot of big words in there.
Yeah, and you got no glasses on now.
Yeah, I know. But if I were to look at that little kid, and I would, number one, do my best to try to give him some guidance that lacked in my life. Try to give him some direction. Try to tell him that, yeah, life's going to kick you in the ass several different times, but there is a way out, and it does get better. Tomorrow is a new day. The sun always rises. All those little pieces, all those little pearls of wisdom that you tell yourself every day when you get a little down, you get a little low. And, like everybody else, I'd say, okay, stay away from this person and don't go here and don't go here. That if you had that time machine. But ultimately, I'd tell him, in every walk of life and every mistake that you're going to make, and you're going to make a lot of them, you are absolutely right where you're supposed to be at all times. Don't ever think you're in the wrong place or the wrong time. Don't ever think you have bad luck. That's where you're meant to be, because it's going to make you who you are eventually. And listen, hopefully in 20 years I get there.
Well, the other thing is, don't be afraid to fail.
That's
You
big
learn
one.
more off of your failures than you do off of your successes.
Yeah. And
if
nobody's
you
going
keep-
in a straight line.
If you keep succeeding in everything, you're really not going to learn much. You got to fail in order to pick yourself up and come back as a stronger person.
Kelly, thank you so much for sending that in. I really do like that question. I like that question a lot because I
We could go on all night about that.
yeah. But we are sitting here. Unfortunately, we are sitting here with royalty. We are sitting here with the breast whisperer.
I was going to say breast royalty.
Breast, the breast of the breast. Dr. Cohen, your specialty is breast reconstruction.
Yes.
And I have read your biography. I have read a little bit about you.
Yeah.
Why don't you tell our audience a little bit about yourself?
Well, where I trained and that kind of thing.
Absolutely.
It's the hardest question we could ask people.
I
Tell us
know,
about
really,
yourself.
about myself.
I could tell
talk
you
for
the
5
anatomy
seconds or
of
30
anything on
minutes.
your body, and you could spell it out textbook. But
Well, I was a nerdy little kid, and then I went to medical school, and
Where were you born and raised? You were born and raised in this area?
I was born in Brooklyn, actually, and my dad was a doctor. He's a gynecologist, and his dream was always for me to be a doctor,
which is
I didn't have a
amazing too.
choice.
Coming from a police officer's background, it's the one thing I didn't want my son to do. It's just like playing football. Playing football till I was 22. I never wanted my son to play football. Well, guess where he gravitated to? That's all he wants to do.
Well, it was the opposite in my family. He really literally whispered it to me in my cradle. It was like it was an inevitability. It was going to happen. But I did. I went to medical school, loved it. I knew when I went to medical school that I was going to do surgery. And if it wasn't surgery, I was going to leave medical school and be like an architect or something because I wanted to do something. I knew it was going to be something physical with my hands. I was an artist when I was a kid.
Well, aren't you really like an architect now, though?
Yeah,
You do build.
Yeah.
My
Building
favorite
thing-
architect, by the
building
way,
things.
is Art Vandelay. And for those out there who can pick that one out, you watch way
Good
too
for
much
you.
TV. Yeah.
Went right over my head, so I don't watch too much.
No, that's
TV.
not hard to do. You're kind of short.
If it wasn't on a rerun of Friends, I don't know who.
Well, it was
Art
Seinfeld.
Vandelay-
That was George's alter ego. It was Art Vandelay, the architect. And he was also a latex salesman, but that's a different story.
But we were saying before, I didn't, go into medical school and say, gee, I want to be a boob doctor.
But there was no,
didn't happen
it
that
wasn't
way.
like a clear-cut direction. It's like, I want to be a surgeon.
Yeah, back when I did my training, in order to be a plastic surgeon, you had to go through general surgery first. So we all trained in general surgery, and that's like the boot camp. It's like the army of medical training. So
And you practice on cadavers when they're going through the training?
no,
No?
you do that in your first year of medical school. That's sort of like the rite of passage, to get you through that section, and then have you be acquainted with suffering and death and that kind of
Sort of
thing
gets
on
to see if you
topic.
got the stomach for it, right?
Exactly.
Yeah.
Yeah, exactly. And mostly I didn't like the smell of that.
The smell of it's pretty.
It's-
When you get into the bowel tract, it's pretty bad. It's pretty bad.
The smell of death is terrible.
It's bad.
Yeah.
But when you go into surgery, you learn mostly your anatomy from actually seeing it in the operating room, and that's much different than when you see somebody after they're gone. So that's a whole different experience.
You get to see people wake up after surgery.
You do. That's always
Not working
good
on these dead
ending.
people.
Yeah. Yeah.
But you train through seeing it, live and in action, and then doing it a little bit and getting through that.
Well,
But-
had you performed before you chose your field? Had you performed? I don't know the path of a surgeon.
Yeah.
Okay, that's basically the question I'm asking you. Is did you have to perform different types of surgeries or assist or do things
You
like
know what's
that?
really interesting about surgical training? No one ever tests whether you can use all 10 fingers. They really don't.
Are you good
it's
with a
surprising.
scalpel?
No, seriously, it's surprising to a lot of people that they don't take you to a Chinese restaurant and see if you can use chopsticks. Nobody ever does that. There's no test for that.
Finger dexterity
They,
test.
yeah, there's nothing to that. They bring you to the operating room, and eventually, you'll see it. But when you do have to apply for your surgical residency, so medical students do 4 years of med school after college, and then we all go to residency. Residency can be a surgical residency or it can be a medical residency, but surgeons all go through surgery training. And when I did it, it's a little different now, but when I did it, we did 5 years of general surgery training first, and then we all did our plastic surgery fellowship, which is usually another 2 or 3 years after that. So
You're 11 years into it.
years, yeah, 11 years.
See how I did the math on the fly like
That was pretty
was
good.
good.
That was
That was
pretty
good,
good.
right?
Yeah.
I
Because
counted.
That's
But
not easy to do.
no,
I
while
got
you're,
flip flops on so I could use my toes.
while you're doing this,
Yeah.
are you getting paid or do you have to work a side job?
So you start getting paid after medical school. So you get paid in residency. Yeah, my husband and I were in residency in New York City. We each made $30,000 a year.
In New York City. That's
So you
fantastic.
weren't living in New York City then.
Yeah, no.
And you have that doctor,
Yeah.
you have that sheepskin on the wall, and everybody's thinking, hey, you're a
Oh,
doctor,
yeah.
you're living large. Well, no.
Living in an
no.
apartment
Yeah.
building saying,
Well,
hey, the
the
two
only-
people next to us are doctors.
The only saving grace is I was never out of the hospital. So, you ate there, you slept there, you lived there. So I didn't need to spend a lot of money outside the hospital.
You got real good at sleeping on a hospital gurney, I guess.
So
But I was-
your
I
husband's
was-
your
I was
husband's a doctor
smart.
also?
He's a child psychiatrist.
Oh, nice.
Yeah, and so he had a much easier residency time than I did.
Oh, don't say that at home.
Oh, I say it all the time.
You'll be sleeping on the
he knows
couch.
it.
Or he'll be sleeping on the couch.
But you get to look at boobs all day. He has to deal with childhood trauma.
Whose job is harder?
I'm
right?
going to tell you right now, I'd rather have your job.
I think her husband rather have her job too.
I told you when we were in our residency training and he was a child psychiatrist. Every time we went to a party, everybody always wanted to talk to him about their kid. They wanted to ask questions. They wanted to know what to do. And the minute I became a plastic surgeon, nobody wanted to talk to him anymore. Everybody wanted to talk to me.
Well, did you ever see her husband though? He's like this.
He's big. Oh, he's got the big cans.
Yeah. You should practice on him first.
I just used one of the common vernacular terms that men use for women's breasts. It's like, hey, it's a nice set of cans. It's boobs. Let's get them all out. It's that first day of
You could go for a
sex ed.
while.
That's sex ed. You got to get them all out of there. And I'm sure being around an operating room,
Yeah, oh yeah, we go through everything.
You go through everything.
I think actually in my practice a lot when I'm talking to my awake patients, I use the term boob all the time, and I think it kind of puts people at ease.
It disarms people, and
It completely does.
I'll tell you why, because I've been vasectomized. Okay, after my second kid, I was done, and my doctor, you're real nervous. I did it as an outpatient, so I was awake during it, and my doctor says, "Okay, drop your drawers and hang trowel." That's exactly what he said to me, and I go, "What did you just say? What did you just say to me?"
But vasectomized isn't a word.
No, I just made it up.
That's another. Put that in a podcast
The
dictionary.
Merriam-Donaldson dictionary.
Yeah.
But that's
Okay, go ahead.
you're 100% correct, because what it did was disarm me. I was so nervous. My heart rate was it was up to about 140.
Yeah.
Just sitting there calm, but he brought me down.
Yeah, and the last thing people want to hear is you throwing out medical
terms. Yeah.
You know, nobody cares.
It wasn't antiseptic. It was pernal. The guy's holding my boys. I mean, I gotta, you know what? It doesn't get any more personal than that. And you deal with the same thing.
Yeah.
You're really giving people back their lives a lot of the times, because everybody thinks breast augmentation is, you know, you're going to make these
Getting breast implants.
you know, somebody who's smaller just wants to get. No, it's a lot more than that.
Right. Well, you have both different realms, right? You have the cosmetic aspect of it, which can make people very happy and can change somebody's life really quickly. You know,
Makes guys happy. I know that.
for sure. But that also makes women happy, right? You know, they.
I find
wanna feel like,
women want breast augmentation more than men.
I feel more comfortable when a woman comes to me and tells me she wants it than she tells me that her boyfriend wants her to have it. That always makes me more uncomfortable because I don't really
Because
know
you don't know what
the
the female's mindset's really going to be.
Yeah,
Is she getting it for the right reason?
right. Yeah, you got to be looking. You got to be looking for that stuff. But you know, actually, I have a story about a psychiatrist and a plastic surgeon along that realm.
Sounds like a beginning of a joke.
Exactly. My husband and I were talking, and he had a friend who was a psychiatrist who had a patient who had been working with this woman for quite some time, and she was very insecure and had been working with the psychiatrist for a long time, and had heard that Peter's wife was a plastic surgeon, and said, "Listen, you know, as an aside, this patient of mine wants to have a breast augmentation, and can she go to your wife?" And so she came, and I did a breast augmentation, and the psychiatrist called me a few weeks later, and she said, "I hate you," and I said, "Why?" And she said, "Because I've been working with this woman for like 2.5 years, and I have gotten nowhere, and in an hour and a half, you changed her whole life."
But she won't even go to him anymore. That's it. I'm fine, doc. See
You
later.
also do reductions, I'm assuming, too,
I
right?
do a lot more reductions actually than
Which I think is
breast-
a slap in the
breast
face to God. I'm
augmentation.
sorry to tell you. It's like God gave you this gift and you just. But I understand.
I will tell you, the breast reduction patients I have are the happiest patients.
Because they don't have back
It's
problems.
tough on the lower back if they're
Happiest
that big,
patients I have.
right?
Yeah.
Like he's got
And
to
I've
get.
never had that problem.
And that's all-
He's
you
got to
know-
get a headectomy carrying around that melon on top of his shoulders.
No, it's because
It's
my
hurting his back.
because my brain is so big.
It's a swollen head.
what, if you do a breast reduction, right? It's really fat that's in there. Is that correct?
And gland, which looks like fat.
What do you do with that after it?
Make soap.
Do you like put it into the next patient? Hey, listen, I just took
Recycle.
I
Yeah,
get
exactly.
a lot of requests for that.
Yeah.
Could you just take it out of my friend because she doesn't need it?
That's
and
where I
give
was
it to me,
going.
please. No, you can't do that. It goes to the pathology lab, and they do look at it actually, which is kind of a waste of time because I don't often find anything. But it does any body tissue removed from a human, you have to send to pathology, and they will look at it to make sure there's nothing, no breast cancer, nothing bad.
And it's got to be held for a certain time,
We
correct?
weigh it, and then it goes on a slide, and then they dispose of it. They burn it.
Somebody, I read a story a long time ago. I can't remember where I read it. If they remove something off of your body, there's a time frame that it's got to sit before it gets disposed
You know, I don't
of.
even know what the time is. Yeah.
Yeah.
I don't know. Yeah, I don't even know.
Once
what
it goes
the
to
time frame
pathology,
is.
you don't care anymore.
I get a report, and that's what I know.
How long does it take to get the report back? So maybe that's how long it takes to
Takes
get
a week.
Yeah, there you go.
Takes a
Well,
week.
there's
Takes a
so many different types of plastic surgeon specialties. There's
Right.
rhinoplasty, there's Botox specialists, and Botox seems to be the big one now.
week. Right. Well, it's very common. I mean, not all plastic surgeons. No, take it back. All plastic surgeons can do Botox, but not everybody who does Botox is a plastic surgeon.
Yeah, nurse practitioners can do it, correct?
Just dermatologists, gastroenterologists.
Gastroenterologists.
Yeah, there's lots of people who do Botox who didn't train as plastic surgeons.
Because that seems to be the big thing.
Yeah.
I don't know. I
Yeah.
just
Not going to go there with that one.
I'm 48. I'm good. I'm good. You know, this.
But what I was going to say when we were talking about the breast reduction is that, that's one side of my practice, the side where people want something and I give them what they want, and for whatever their motivation is, I change their life, I make them happy, I make them feel better, whatever it is. And then there's the other side of my practice, which, started off my practice probably about 75% of my active practice was breast cancer and breast cancer reconstruction. And now I'm so busy with everything, it's about 50-50. But
So you had people, two parts of it. You had people that needed it,
yeah,
people that wanted it.
right.
The people that wanted it want the breast augmentation or the
Right.
breast implants and everything. Then you
Right.
go with the cancer patients
Right.
who are people who need it.
And doing the stuff that's wanted is fun and it can make people feel really, really happy, and you can, as a plastic surgeon, it can make you feel really good about yourself. But my passion is for helping people in the way that I help them when I do breast cancer reconstruction, and that's a whole different thing.
It's the choice that
Yeah.
gets me. So women have the choice of having this option. If there was some sort of augmentation for men, this is the imbalance. It would be in the Constitution as an amendment, as a God-given right that the government would pay for. And I'm dead serious with that one.
No, you're right.
It would be a right more than
Absolutely.
anything else.
Yeah. Yeah.
Yes.
I like that.
Oh yeah, all day long. But you now there's a new trend that I obviously came out with Angelina Jolie. She had both her breasts removed as a preventative measure. I mean, there's upside. There's a plus and a minus to that. I see. Hey, listen, it's great. You're getting ahead of the curve until it hits you, but at the same time, it's very elitist, in my opinion, in order to do that, because not everybody has that option.
Yeah, 100%. And not everybody gets offered the option to even know that they need it, right? Because you need to have a blood test, and it's a special blood test, and it has to go to a special lab to find out that you have the gene. And if you have the gene, then you have, then you talk to the plastic surgeon, and then you get given the option in order to do that. And
have you come
you're
across this?
absolutely right. Sure. Yeah, we do prophylactic mastectomies for patients who have BRCA.
Prophylactic?
Yeah, prophylactic.
Yeah, write that down.
Well, the only other prophylactic I've ever heard of is not.
Of course, I was
going
to go there, right?
Right.
You got to
Prophylactic
realize where
means-
his brain runs.
Prophylactic means you're doing it to avoid something else, right? To protect
Okay,
against something else.
that makes
right?
sense.
But no,
So-
in a case like that, you could actually get your breast removed and get implants put in. Will that prevent breast cancer?
Yes.
Really?
Yeah,
100%?
Yeah. So there's a gene you can inherit, generally from your mother's side, called the BRCA gene. And there are some other genes now, too, that they're finding. But mostly the BRCA gene, it means that if you have a certain type of BRCA gene, you have an 80% chance of getting breast cancer in your lifetime. So, that's a kind of a no-brainer if you know that you have that and you know you're going to get breast cancer. If you remove the breasts, you can reduce the risk of getting breast cancer by about 96 to 98%.
Wow.
So that's a big, that's a win-win. That's not a lot of thinking about it. If you reduced it by 15% or 30%, that would be a much bigger, right? That would be a much bigger choice, I think. But this is kind of a no-brainer. It's like you can remove, and the only reason it's 98% is because you can't physically remove 100% of the breast tissue. So that's the only reason why it's not 100%.
Nothing in life is 100% except death.
Right.
Well,
Exactly.
I'm thinking about the entire scope of your practice, specifically as it relates to boobs.
Right.
Boobs.
Because it's not all boobs either.
But
He said boobs.
Yeah, so I'm trying to make sure I hit all the points of what you do. You do augmentations, you do reductions, you do lumpectomies, you do, and I imagine you do some men too, because
So
breast
I
implants
don't do
are
the
men.
lumpectomies, actually. There's
Oh,
a
you don't?
difference
Okay.
between myself and a breast surgeon, who is a general surgeon, is also a cancer surgeon.
Mm-hmm.
So technically, I'm not a cancer surgeon for breast because I'm not removing the cancer.
You come in afterwards.
I do. I
Yeah.
come in and just
after
do
the engine's
reconstructive
rebuilt, you
part.
come and
Yeah.
put the tires
Yeah.
back
Fill it with
on.
oil.
Yeah, I was thinking about that. I was thinking about that before I came. There's two issues when you talk about breast cancer. There's the cancer issue, and then there's the amputation issue. There's the reconstructive issue, what you're removing. And so my part is really the reconstructive portion. Although what usually happens is every woman who finds out she has cancer from their gynecologist or their breast surgeon or the person who did their mammography or whoever they found it out, they start processing it, and then they come see me. And so by the time they get to me, they've sort of just started to formulate all the questions that they might have about the cancer. So if I don't know how to answer those questions, I'm not doing my job either. So even though I'm not the cancer surgeon, I end up dealing with that issue.
You have to school yourself in that.
Sure.
In the whole cancer process,
Sure.
so you have
Yeah.
the answers.
Yeah.
But you're dealing with men these days too.
So men get breast cancer.
Yeah.
Lots of people think, well, how can they get breast cancer? That men have breast tissue, and so they do get breast cancer.
And a man,
Certainly, it's a smaller percentage.
for a
it's
man,
about-
that's got to be an incredibly emasculating experience.
I agree with you. I mean, we talk about it a lot in conferences and things, and it's like, oh, yeah, men get breast cancer. And I'm like, wow, that must be a whole different set of psychological
It's like a
turmoil.
smack in the face.
Like
to
if we
a guy.
get testicular cancer,
Yeah, it's like,
Yeah,
Okay.
a female can't get testicular cancer.
Right.
Why should I get breast cancer?
yeah, there you go.
but we get testicular cancer. We're like, okay, this is something that can happen. We have them. It could happen, but
Yeah.
we don't have.
You
breasts.
don't think about it for breasts.
We don't
yeah.
have. We don't have. And I know people that have had that.
Yeah. I knew a young man who knew him not in my practice at home, where he had some trauma to his breast, and he had to go have a mammogram because after the trauma there was a lump there, and it was just
Ooh.
bleeding, and there was a swelling in there. And
You imagine the
he had a
names he
lump.
was called.
Oh.
But
Yeah, look at you. You're going to get a mammogram.
He told his story about his purple nurple for I mean,
Purple nurple. See, now, that's another thing with breasts. Purple nurples.
Tune in Tokyo.
he
Are
talked
these things
about-
on them, or I just wasted my time?
I'm sorry, doctor, but to hear a doctor, is that a medical term?
Yeah, oh yeah.
That's a medical term.
Oh, yeah.
To hear a doctor say that, it's actually refreshing. It's actually refreshing to hear because
When you talk to a doctor, you think you're going to get straight cut. Doctor
Dr.
talk,
Marcus Welby.
Yeah.
Yeah.
Well, I can go down that road.
Marcus Welby, MD.
I can go down that road, but you guys will be asleep.
Yeah, pretty much so.
So
I'm glad you're staying this way. I
But,
like
but
it.
the point is that this guy had to go have a mammogram and sit in the room with all the women in their bathrobes, and just that, and he didn't have cancer. He just had a bleeding into an area, and it got better by itself. He didn't have to do anything. So I can imagine male breast cancer. I haven't had a patient who has it.
Are we covering everything? Is there anything that we haven't mentioned that you take care of in your practice?
Well, I do all kinds of cosmetic surgery, and I do, which includes, tummy tucks and facelifts and things like that. So it's not just the breast anatomy. He's looking over at him.
I asked you if
You
you could do
ready?
anything about this yet.
I am accepting of the way that I am.
Yeah, that's why you grow a
there you
beard
go.
to hide your face.
Absolutely.
So there's a lot of different body parts involved, not just breasts. I also take care of skin cancer, so that can be on any part of the body. So skin cancer is very common. And I do go on a surgical mission trip every year where we go to other countries, and I do surgery just on children. So that's a whole different aspect of my life and my practice, but I do that every year where
I do want to get into that.
Yeah,
I do want to get into
I
that.
do cleft lips and palates and lots of burn surgery. Horrible burns.
Why is it, and sorry to get off track, but why is it you see all these kids from all these different countries with like cleft lips?
Yeah, really interesting thing about that is that the prevalence of cleft lips, which is the one you can see, you can't really see the cleft palate, which is on the inside. The prevalence, the percentages of cleft lips in children in other countries is about the same as it is in the United States. It's just that they all get fixed here. So most people, if you think hard enough about like kids or people or maybe kids that were in your kids' classes, everybody probably knows someone who had one.
But got taken care of early.
But they get fixed when they're little babies here, and then they get their dental work, and they get their hearing fixed, and they get their speech worked on, and they get all that stuff that you don't get when I showed up to Ghana in March of this year, and we hadn't been there for 2 years because of COVID since 2019. And there were kids were coming who were 10 years old who'd never had it fixed, and that's much more.
So now you could do like
startling.
reconstruction on a cleft palate,
Yeah.
or cleft lip, and all that stuff.
Yeah, I put those all back together.
And then give them
again.
back some quality of life. But
Yep.
there is a sect of your profession which I take umbrage with for a little bit because there's some unethical practices. And
Oh, don't get me started.
there's people who are doing things where I just do, and we'll go specifically with the field of breasts.
Yeah.
I used to go to a gym with a woman, and she was an adult star, and she was about 5 foot tall and looked like she had basketballs on her chest. She looked absolutely ridiculous, and everything else in between was done. You know, the curling
lip
iron.
implants.
It looked awful. But she was an incredibly bright young woman, bright, like super smart. Drove a high-end Mercedes or something like that, and so when I got comfortable enough to ask her, I go, why? Like, why do you do that? Because she couldn't even do lat pull downs because the bar would do like a half rep.
Yeah.
I said, why do you do this? She goes, because I make a lot of money doing this, and that's her exact answer to me.
Mm-hmm.
But some doctor put them in.
Yeah. Yeah, see, I don't mind that so much. When I have someone who I feel like their motivation makes sense to them and they're not going to end up on some psychiatrist's couch because they have it later on, because they understand what their motivation is, I don't have so much trouble with that. I have my personal aesthetic about the type of plastic surgery that I do. I think a lot of what you see on the street and you go, oh my God, what's that? You know, giant lips or giant breasts,
or the asses. Now you get the diaper ass.
I think a lot of that gets into the there's a lot of money at stake with plastic surgery, right? So anywhere there's a lot of money at stake, there's a lot of abuse that can happen, but also that's part societal, right? Women are going in and asking for those things.
But do you ever say no?
I say no more than I say yes.
Really?
I was going to say, as someone that comes in with that wants these like oversized breasts,
I say no more than I say yes.
Isn't it like a doctor overprescribing medication?
That's where I take umbrage.
Well, you know, a doctor who makes those breasts that are way over large look like a clown, and you know, lips that are way over large that no human being would ever, the butts that look so big that no human being would ever have those. It's almost like it's almost like you're a costume designer at that point. You're not really a plastic surgeon, right? You're doing something that doesn't look natural. It's not like what somebody, even a beautiful person, could be born with. You know, I mean, Angelina Jolie has beautiful lips, but people were striving to get that.
But
I don't know, there was an ideal that people wanted to look that way, but her lips on me would look ridiculous, right? So that it doesn't matter a lot of times. People get focused on one thing.
You get that body dysmorphia, like a Michael Jackson situation. You're
right.
like, well, okay.
So again, the woman who has very large breasts because she's making money on it and it makes her happy and everybody's happy about it, I don't have any problem with that. But when you get into the body dysmorphic thing, when someone comes and I'm a little suspect about their own motivations, or I can tell instantaneously that this is never going to be the end of it, there's going to be something else, and there's going to be something else. And what happens with someone who has that problem is that they obsess over something, and they think that doing this quick surgical procedure is going to fix it.
It's going to fill that hole in them.
Yeah, and that hole's never filled, right?
It's like the people the women that want to look like Barbie dolls.
Right.
Yeah.
You know.
Yeah, there's a pathology to that, right? Like that's not normal.
But there's always some doctor. If you're going to say no, there's some doctor that's going to say yes.
Yeah. And so there's that aspect where you say to
yourself, so are you losing money
well,
because that doctor's going to make the money?
To me, honest to God, it's not the money. To me, it is if I can do it correctly on this person, I know at least that they're not going to go somewhere where someone's going to hack them up and make a horrible job of it. So there's that. But I do, for my own self-preservation, I say no all the time.
They look like a Muppet with one nipple up, one nipple down.
Well, and that was a question I was leading up to. As a former police officer, I love watching the show Cops.
Right.
Because that's what we did. Did you ever watch the show Botched?
I've never seen Botched, but those guys are actually they're good at what they do, and they are
no, but the surgeons before weren't that good.
Yeah, so a lot of people, I call myself the botched breast surgeon of Bergen County because I do a lot of secondary revisions.
I was going to say, did you get? Yeah, exactly.
Yeah, so what I hear about those guys, it's hard for me to watch reality TV. I can't stand all the commercials and the nonsense. But I've heard that they're very good at what they do and that they really fix people and they do a good job of fixing people. But I have a similar attitude to that. A lot of plastic surgeons don't like doing secondary surgery, fixing somebody who's been
fixing someone
botched
else's.
up someplace
exactly.
else.
I think every industry has
love
those
doing that.
fixers.
Yeah, I love doing that.
You know,
I
really?
love
Good
it.
for you.
barbers have them. There's somebody that gets a jacked up
Right.
haircut.
Fucked up haircut.
Some plastic surgeons won't
I mean,
touch
look at
somebody
Eric.
else's work, you know?
I touch up his hair all the
So
time.
in the studio, just so you know, we have Tara
Our
Malone,
own.
and our own Eric Engelhart. They're here viewing, sitting behind Andrew, and they're laughing and stuff because we're talking about boobs. I'm watching him smile right now. Boobs.
just keep saying boob and watch Eric go.
But that's where
his shoulders go down.
That's really where you become. Your ethics get involved, and is there anybody governing?
There's a lot.
Is there anybody governing the ethics of your field?
Well,
I
there
know
is
the
an
American.
ethical body. Yeah, the American College of Plastic Surgery does have an ethical body. So if you do something really out there, you can get sanctioned.
Sanctioned, or what
no one's sending
happens?
you to jail, for doing it.
Because it's really mutilation.
Um,
You know, you go to those third world countries.
It's so
They used
interesting.
to
Yeah.
do.
Yeah.
They used to do circumcisions
Yeah,
on
it's
women.
so interesting because who knows? 50 years from now, we might think all breast augmentations are mutilation. You know, they might look back at us and go, "What? They were putting bags in where?" You know, we look at people who used to put arsenic on their face to make it pale, or cyanide, or whatever it was.
It was the arsenic to make their cheeks
to make
red.
their cheeks, and we look at that and we go, "What are they, insane?" You know, so someone somewhere is going to look back on this. and
Things
say,
that are
"This
going
is
on
crazy."
today, 100 years from now, they're going to say, like, what are you, crazy? You know, they're going to come up with a new theory that's going
Right.
to say, why'd you put silicone in there?
Yeah.
Why didn't you
So
put...
we all have to draw our own line, what we feel comfortable with. I think cosmetic surgery really is only done well when you don't know someone had it. That's my own personal aesthetic. That's my own personal aesthetic. I do, in order to be a patient who gets me to go past that, you have to give me a really good reason why. You have to give me a good reason that I'm comfortable with and that I think the patient will benefit from.
Because you're ethical.
Right.
Well, there's a misconception amongst women that in order to be attractive to their attracted sex, you see how I did that? You see how I danced around that?
Yeah, you danced right around
I
that.
danced right around that. You got to have women in general. They have to have big boobs and they have to fill out a dress a certain way. When it's really not the case. It's really not the case.
And, maybe, sorry to disappoint you guys, but the breasts are getting smaller and women are asking for smaller and smaller and smaller. That's a trend. I've been doing this for 24 years, and I will tell you that the sizes that women have been asking for, especially the younger women, they're asking for smaller sizes.
But that's like paying for a Mini Cooper when you can afford a Bentley.
See, sorry to disappoint. I knew it would disappoint.
How many people have come to you that had these large breast implants?
Yeah.
Wanted them to take it out and get them
Well,
smaller.
that was a movie.
lot,
Did
a
you
lot.
ever see that HBO movie years ago called Breast Men? It was about the first people.
No, actually, I never saw that.
It was about the first people who really learned and popularized the breast implants, and they got sued left and right because they were putting in harmful chemicals. Women were getting cancer. And,
there's a really interesting thing about when plastic surgery sort of in its infancy, in the 70s and when it all sort of started. And, it was all male plastic surgeons. It was all female patients. And I have had many patients who are in their 70s maybe who had elective cosmetic surgery in the 70s, 80s. And they went to sleep and no one ever asked them what they wanted. No one ever asked them what surgery they were going to do. No one ever asked them what size they wanted to be. They woke up the way some
You get
male
what you get and you don't
plastic
get upset.
surgeon thought they should look.
That always cracked me up, though. You see someone like this whole sagging body, but their boobs are sticking out like this.
And so I find that fascinating that you could, that there are these lots of women out there who they were never asked what size they wanted to be. So a lot of those people will come and they'll ask.
Wasn't
them
there
to be
consultations before it? And don't you go through like the different size bags?
changed. But it really used to be.
bag.
Nowadays
size
it's
bag.
very
different
different.
size bags.
It's like you're at ShopRite. No, I need the bigger bag. I got a lot of
do.
groceries.
They go in my office and they try on the different sizes.
And you didn't bring a sample.
Do you call them bags or different size implants?
They're sizers.
They're sizers.
Okay.
But-
size bags.
but,
my
sorry,
I'm sorry.
body types change over time.
Yeah.
If you look at, they would call them Rubenesque women's because Ruben was the artist who they were very full,
They were
figured
round
women.
and big hips
And if you looked at the women in the 80s, it was beanpole. Now it's more heading towards that Rubenesque style where,
Yeah.
the bigger butts
Yeah,
and the
sure.
smaller waists
Yeah.
and stuff like that. So That's the problem I have with any cosmetic procedure because it's a trend. It's like buying a pair of Cavaricci jeans, and in 10 years, they're no good. You know what you had plenty of pairs. I was too poor to afford them, but you had plenty of pairs of Cavariccis.
You wore your Capizios with them too.
Oh, okay. All right.
And your members only jacket. Come on, man.
You were the only member.
Hey, listen. Exactly.
But it seems like this never ending thing because those women coming in for the bigger breasts several years ago are now coming in to get them reduced because that's the trend.
Yes.
Where now we have this opportunity in this day and age we live in order to choose that. You're not born. It doesn't. The way you're born doesn't mean that's the way you end.
Yeah.
Yeah. So.
Well, women can come in and ask for them bigger, and then come back 3 years later and ask for them smaller. You certainly can do that. That's what they used to have an adjustable size implant that you could put in,
like the Reebok pump.
And I would refuse over and over again to put those in because if you decided Thursday that you wanted a different size from what you were Tuesday, I don't want to have any part of it.
They're going out this weekend, so they want huge breasts, and on Monday they're going to come back and they're going to say, I want smaller now.
They had adjustable size.
Now, if you do, I guess it's a reduction, an implant reduction. Would that?
If I put a smaller implant in?
If they come in with bigger ones and they come in and want smaller ones, you have to cut out the skin and all that because
most of the time.
They attach, right?
Most of the time. So it's not a without consequences because there's scars involved in that.
Yeah.
Well, so you probably get this question quite a bit.
Well, here we go.
What is the oddest request you've ever gotten? I know you've gotten this one.
A third boob?
Yeah, like the Total Recall. Absolutely. If you ever go in for that, I got to see pictures.
That's probably the number 2 most commonly asked question of plastic surgeons. The first one is how many stitches did you put in? Everybody wants to know after you did a surgery, or mostly when they get a cut and they see a plastic surgeon in the emergency room. Everybody wants to know how many stitches. Makes no difference, by the way.
Yeah, enough to fix, enough to fill it,
to close it, right? But the oddest thing. I will say the thing that comes to mind first is, but I was a resident at this point. Somebody asked for the attending surgeon to remove their belly button and not replace it.
Whoa.
Yeah, which is an unusual request. Didn't really seem to have a motivation behind that. And it's interesting because every once in a while I have to remove someone's belly button for medical reasons.
I was going to say you do it for medical reasons.
Medical reasons.
That is the oddest thing.
And I had one woman who was about to have a gynecological surgery, and I was telling her that, again, for medical reasons, I was going to have to remove her belly button. And our medical term is umbilicus. But at any rate, and I told her I was going to remove...
Umbilicalectomy.
Yeah.
Umbilicus.
I told her I was going to remove it. She burst into tears, and I said, "Why are you crying?" And she said, "Because where are people going to think I came from?" And I was like, okay, never thought about that. But
I'm going to work umbilicus into a sentence.
Okay, there you go.
But the belly
3
button,
times today.
The belly button is all things connected behind the belly button.
Yeah.
It's just not superficial.
Well, when you remove it, it's just superficial.
Is it?
Yeah. It's just the superficial part of it.
Yeah.
But so that was that was just a sort of out there request. I mean, we've all seen pictures of the lion lady in the city and people who want to look like a lion or a lizard, and they split their tongue down the middle.
Wilstein or whatever.
Yeah. That's like the lion lady.
Like I want to get my nipples removed because it's aerodynamic.
There you go. But I think the thing I see the most, I don't get a lot of like totally out there requests.
A lot, but you do get some.
Not really. But I had to reach pretty far back to get the one who asked to have the belly button removed. But the things that are out there are when someone comes in and they clearly don't need something that they think that they need, and those are the ones that make me feel like that's when I say no, when I can see that whatever, the requests are getting weirder and weirder, right? Like you want this person with these big lips that don't look like they could possibly be natural, and somebody wants you to put more in, or someone's had so much Botox that they can't move their face, and yet they don't want to have to squint when they go in the sun, like those to me are very strange requests, because if you just take a half a step back and look in the mirror, you'd see that that's not what you need. That's not.
Now you'll also do like facial reconstruction and all that also?
I don't do a lot of facial reconstruction here in the United States. One of my partners does a lot of rhinoplasty and does a lot of revision rhinoplasty. Dr. Winters is my partner, and the only cosmetic procedure really that I don't do is noses, and he does all of them.
That would save my life. I had the septoplasty.
Uh-huh.
And that actually saved my life.
Yeah, really.
So
you had that nose worked on surgically?
I couldn't breathe from boxing at such a young age. I couldn't breathe through my left nostril for 20 years.
Yeah.
And when I had that septoplasty done,
it's a whole new world.
It was a game changer for me, because I used to think, and I guess that's a form of plastic surgery, but it's a medical procedure.
Yeah.
And I used to think plastic surgery was strictly aesthetic.
Right.
It's not.
Right.
It's not. This opened up my nostrils and allowed me to breathe for the first time. I remember after, blowing out just the grossest stuff you ever see, just taking a deep breath and going, my God, this is what it's like.
Is that like a deviated septum?
Yeah.
Stuff like that?
Yeah, that's exactly what I had. And I in order to get the because my nose is crooked, in order to get the rhinoplasty, it was like another $5,000. I'm like, I'm all right with my crooked nose.
We'll just
I'm
leave
good.
the crooked nose.
I'm good. I'm good.
Well, but to take that a step further, he also does surgical reconstruction for facial reanimation. So when somebody's born without the muscle function on one side of their face and their face kind of droops, he specializes in that as well. So that's just a completely reconstructive side of that, or nasal reconstruction or skin cancer reconstruction or things like that. So.
Okay, we touched on the funniest. Let's hit the worst.
Oh, boy. I've seen...
I was going to say, what was the worst where you just sat back and said, okay, just let me go in the office and I'll be right back. And he said, holy shit, what am I going to do with this?
Honestly, the worst I see is when I go on my surgical mission trips.
Yeah.
And every single trip, I could give you 3 or 4 examples of the worst thing I've ever seen that no one here in the United States would ever see. And the reason I see a lot of that stuff is because when you have burn surgery, that's not the same as in the United States. Anybody who gets a burn across a joint can get what's called a contracture, which is where the scar heals so thick.
Can't move it.
It's incredibly strong and incredibly tough when it takes months and months and even sometimes years to heal, because there's no skin grafting and there's no surgery for it and all that kind of thing. So
it's going to be like physical therapy and stretching it and all that too.
They don't get any of that. They don't get any splinting. They don't get any of that. So it's they don't get any skin grafting, and skin grafts don't necessarily keep you from getting this, but skin grafts in the United States, in addition to all the splinting and the physical therapy that they get. So when you get a burn scar contracture like that, I see it all the time. I see kids who have their arms fused to their sides from the shoulder all the way down to the elbow. Can't put a shirt on. Who have their elbows stuck in a very acute position because their wrist is stuck to their shoulder, or their heel of their foot is stuck to their buttock, because there's literally just scar in there where they literally can't open it or can't move it. So
your heart has to bleed for these things when you go there.
Just crazy. It's just crazy.
I was going to say, after these missions, you got to take that home with you too. I mean, you when you put your head on a pillow at night, you got to think about that stuff.
So the craziest thing is when you go back to your practice the next day and somebody comes in and says, after you did that Botox, there's this one little wrinkle up here above my eyebrow.
You don't know what I've just been through.
And the first time you do that, you're like, oh boy.
Yeah.
The day after 9/11, someone called my office and said, I had a Botox appointment for today. Can I come in? And we were like, no.
Yeah.
We took the day off.
Wow.
So
we
yeah.
become so narcissistic and self-centered.
It's just, you're just thinking inside your own head, right? But you know what? I've gotten used to that. I go on a lot of mission trips. I go on one every year, except for during COVID. And you see the most incredible things. The suffering, to use the podcast name, that you see in these developing countries that we can't even really process, because it would never happen here. I mean, just a simple, easy example. One of the first mission trip I went, we were in Morocco, and we were doing our thing, and next door there was a Moroccan surgeon who was taking care of the stuff he always takes care of, and little girl came in with a big cut on her foot. It was just a run-of-the-mill cut, but it was big, and he was stitching it without any anesthesia.
Anesthesia.
Right. So the kid was wide awake and there was no local anesthesia. So you go to the emergency room and they put stitches in you. The first thing they do is they clean it up and then they stick needles in you, unfortunately, but they numb it so that you can't feel it. And the kid's screaming bloody murder. And my nurses are losing their minds, and everybody's upset that this doctor is, torturing this child. And they're, why doesn't he use lidocaine? Why doesn't he use lidocaine? And I said, he doesn't have lidocaine. And a lot of people would say, well, we have it, we can give it to him. And I said, well, we can, but then tomorrow, when we're gone, they're not going to have it again, and they're never going to have it. They're not going to. It's not like if you went to the emergency room in the United States and somebody started putting stitches in your kid without any lidocaine, you'd be like, get lidocaine, and they'd say, well, we don't have any lidocaine, and you'd say, well, then go somewhere else and get it. You don't just have that in your head that there's a possibility that there could be a scenario where you couldn't get it.
You take it for granted.
We just take it for granted, right?
But
And
you
it's
have
just a
some
whole
huge,
different.
you have some huge victories though, aside from these missions that you take.
Mm-hmm.
You're a plastic surgeon. You do boob implants. Okay, you do the unnecessary, but there's more to it than that.
Sure.
There's more to that.
Sure.
And we have a person in the studio right now who I know personally the things that you've done for her self-esteem and her way of life, and really given her back her life, and that's our very own Tara Matalone. We had her in on episode 76. See how I remembered 76?
Yeah, see that?
See it? And she speaks so glowing about you that's
And
why
she's the reason that we got Dr.
She's
Cohen
the reason
in today.
I'm here.
it's the first time I heard the boob whisperer, the breast whisperer. So that's got to be one of your most rewarding stories.
That is, so Tara's one of my most rewarding stories because
Her attitude is strange. There's something wrong with her. There's nobody that should have an attitude that had breast cancer like her.
Exactly. There's no one that should go through something that Tara went through and to be as bubbly as Tara is.
no,
disgusting.
It almost gets me sick because I hate myself sometimes. And
Which
Tara
is, I
walks
think,
in
why
and
you
goes,
had her on the
"Hi."
show, right?
Yeah.
Because it's just such an amazing example of going through someone going through a lot and getting to the other side. I think the thing that I really like so much, and what keeps me going about breast cancer reconstructive, why I've been doing it for so long and will continue to do it for all this time, because it's the hardest thing I do in my practice, because the time that it takes out of my regular elective practice and the amount of things I have to shuffle around and change because I found out someone has breast cancer and they need me and I can't tell them, well, come back in October,
Yeah, exactly.
because
You don't know if you're going to be here in October.
you can't make somebody wait. So it's very taxing in order to do it. But I'll never stop doing it, because doing breast reductions make me feel great, and doing breast augmentations are fun. But doing breast cancer it's a whole different thing, because when I meet someone, as I was saying before, when I meet someone who comes once they've just found out they have cancer, they're in that moment in time where all of a sudden they have all these questions in there. They've just found
So
out.
you're meeting people at the lowest point of
it's
their
the
life.
worst point of their
And
life.
you're
right
giving
then
them
and
something to look forward to.
And what I have at that moment in time is I know the future, right? Like, I know that however this comes out, when we get to the end of this, you're going to think about this 100% different than you think about it now, because you can't see the end. When you hear those words, you have cancer, you can't see the other side. You have complete blindness.
You're stuck in that spot
Exactly.
right then and there.
And I've been doing this for 24 years. I know the other side. I know the majority of the other side. I know the minority of the other side. I see all of it, up, down, sideways. One of the first things I say to people when they come and they found out that they have this, and they found out not only that they have cancer, which is probably the worst word anyone will ever hear,
The dreaded C word.
but also that they're going to have an amputation. Most people
Lop
don't
'em
think
right
about
off.
a mastectomy as an amputation, but that's really what it is. They're going to lose a body part that has a lot of, emotional stuff. It's not a finger, which is bad enough in and of itself, but it's this symbol of, femininity and desire.
Think about little girls. Little girl looks in the mirror and says, "I can't wait till I grow boobies and I become a woman."
That's why they wear
It's the-
training bras.
Right.
Right?
Right.
They think about that as their trip into adulthood, and then
Right.
all of a sudden one day
Right.
it's over.
Yeah, so that's a huge thing as well. And so one of the first things I tell people when we start talking about this whole breast reconstructive journey, because it is a journey, And I use that word with people because I want them to understand that it's not going to be, like a breast augmentation where you're going to come in, you're going to have the surgery, you're going to go home, and that's going to be that.
Because you still got your nipples, which is still boggles my mind. Like, if there's one takeaway from Tara's episode, it was that and I didn't think about it, your nipples got to be reconstructed.
Right.
Like,
not always. Not everybody has to have their nipple removed, but it's very common.
Cut it off and stick it back on?
No, but it's a little more complicated. Yeah. Actually, nipple reconstruction is my favorite operation. It's
become my favorite also. I'm just saying. I'm just putting it out there.
It's my favorite operation.
If you got an extra one, just put one over there on the side.
The nurses in the operating room will tell you, I love doing it. It's fascinating. It's amazing to watch. And because there's nothing there. And then 10 minutes later, it looks like a nipple.
Yeah, but when you cut the nipple off, does that go to pathology too?
Just keep pinching the skin until it stays.
If you take a nipple off, it goes to pathology with the rest of the breast. Yes.
No, I know all that stuff gets disposed of after that.
Right.
Who keeps those nipples?
Yeah.
I know there's some devious guy out there that's taking that nipple.
Reality, there's a serial killer out there who used to collect them.
Yeah,
see, I'm telling you.
Yeah,
it's like a Buffalo Bill thing. Ed Gein.
It was my cousin. It was my cousin.
Yeah.
So it's Ed Gein.
Ed
Gein is one of he's one of the
box full of them somewhere.
He's one of the most he's one of the most prolific serial killers. He was a loner in, I think it was Wisconsin or something like that.
Killed his mother first or something.
But he's seen more nipple in his life than you have.
But he made they have pictures of it on the internet. He made like a glove out of human hand
or a necklace.
It was
something.
A belt out of nipples.
Yeah.
It was a nipple belt.
So put that in your pipe and
yes.
smoke it.
So yes, there are, and he was constructing a whole skin suit to reconstruct his mother or something like that.
Yeah.
But
like
yeah,
that.
so
God, there's some weirdos in this world.
Yeah.
I'm sitting right,
and I'm joking about them. Sorry. Okay, Doc, where were we?
The nipple surgery. It's amazing. It's my favorite surgery because it's so simple to do, and like compared to the breast reconstruction, breast reconstruction is a much broader journey. But what I was saying was the first thing I say to someone when they come to my office and their head's in a tailspin because they just found out they have cancer, and then they found out they have to have a body part, altered in a significant way, is I say, when we're done with all of this, my goal for every single patient who walks into my office who found out that they have to have mastectomy is that when we're all finished with this, maybe a journey, it may be whatever, it's not going to be tomorrow, but when we're all finished with this, my goal for you is that you get up in the morning, you put your clothes on, you go, and you don't have to think about me or that breast or anything because you feel like you look good and you feel okay and you can put your clothes on and you can go about your business. And when we get there, that's when you and I are done with our journey. So that's my goal for everybody. Everybody gets there in a different way. Everybody gets there in their own way. Sometimes it's faster, sometimes it's slower, sometimes there's simple surgery, sometimes there's really, really complicated surgery. That's what I was doing this morning before I came here.
But you say they're done with their journey, but you're not done with them. You have to have an emotional bond with that person for the rest of your life.
Oh, hopefully Tara and I are going out for drinks after this. But.
So and this is going to sound like a really weird segue, but in college, I put up swimming pools. Okay, that was my college job. Here's what I learned from putting up swimming pools. I will never own a swimming pool. Okay? You being somebody who works with breasts on a daily basis, and you don't see a whole lot of this in your field where they get the surgeries that they're performing. Is it just because I'm done, I'm over it? Is that what it is?
She's happy in her own body.
Well, no, that's a valid
You know what's
question.
really interesting about that? Actually, I don't know how much you know about the actual process of breast reconstruction, but there's basically two categories of breast reconstruction. You can have breast reconstruction. I can make a breast with implants, and I can make a breast with body tissue. So that's where we move body tissue from one area to the other.
I was going to say it's almost like
grafting.
I want to say suck fat out of somewhere.
No. So that's a little different. That's called fat grafting, and you can't really make a fully sized breast doing that. You can fill in small areas, but when we do moving body tissue around, we do that with microsurgery. So it's a complicated surgery. You take usually skin and fat from the belly, attached to a blood vessel that you reconnect up in the breast, and then you use that skin and fat in the same way that the breast would be sitting in the body, so the whole breast is made out of body tissue. That's a vastly more complicated procedure than an implant procedure. Some patients aren't a candidate for. There are lots of patients that aren't a candidate for it for various reasons that go past our discussion here. But there are very different ways of doing breast reconstruction. So for patients have to understand that, first thing that they have to sit down and they have to like understand what the differences are before we can even start to talk about what's appropriate for them and all that kind of thing.
Well, young folks, young medical students getting involved in your field, and this goes back to the social media question. What?
They all want to do Botox.
But that's where the money is. But what?
And it's quick and easy.
Yeah.
What is some advice of the 24 years you've been doing this? What is some advice that you would give that young doctor going into this field?
Yeah, I think unfortunately because of Instagram and because of television shows and because of what you see, I think a lot of medical students they don't actually get a really good idea of what plastic surgery entails, because I think a lot of them do think that it entails doing, Brazilian butt lifts and doing breast augmentations and doing Botox, really to get a really good idea of what plastic surgery is about, you've got to go into the surgical specialty and you've got to go into the operating room and see what we really do, because a lot of people don't realize how much we are involved with general surgery and with cardiac surgery and with orthopedic surgery and with any type of situation where the human body has to be altered in a major significant way. And a lot of times we deal with really nasty, horrible wounds, really nasty, horrible cancer, really nasty, horrible amputations and things like that. And that's the stuff that's important. That's the stuff that's interesting. That's the stuff that's challenging. I mean, I hope most people don't go into plastic surgery to have an easy life, because
I don't think there's
not
any,
the way to do it.
They think the money's good.
I don't think there's any
It's not the
doctors-
way to really do it. And most of us who went into plastic surgery a long time ago, the idea was the cosmetic stuff came later. You learned how to do the complicated stuff. You learned, you went into the operating room, you spent hours and hours and hours in the operating room learning how to do the really complicated stuff so you could fix anything. And then the cosmetic stuff is easy.
You went through the suffering.
That's
exactly what you
the suffering of the
did.
plastic
You
surgeon.
have to have a love for it.
Yeah.
In order to be good for it.
100%.
You have to be a good breast surgeon.
Who, me?
Me.
Oh, yeah. At least you'd be good at one thing then. But you have to really have a love for it, right? And these people, like you said, the reality TV show, you don't have commercial breaks in your life.
Right.
In your profession, you don't
Yeah.
have commercial breaks where, they see that, like, I watch that Dr. Pimple Popper every once in a while, And she goes in there and all of a sudden they go to a commercial break. The guy comes back and he looks fine.
That's the television version of TikTok. Just so you know, you can't, once you watch it, you don't want to watch it. You just can't stop.
And then you can't
turn
stop.
it off.
Yeah. My kids all watched it.
Well, doctor, where can we find you? Like if there was one of our audience members that is in need of your services, where can we find you?
So, Dr. Stephanie Cohen, we're in Cohen Winters Plastic Surgery, and I'm in Maywood, New Jersey. And so, obviously, everybody has the internet. They can go on the internet and find my office.
We'll put a link to it in our show notes because out of everything, we are fans of breast implants. So we want to get
and breast augmentation.
You're here. You're being very open with us. You're being very honest with us, and you're answering a lot of questions from a male perspective that I'm sure a lot of our audience members have. It's not all third grade giggling.
Sure.
It's
a lot of it was.
A lot of it is, but yeah, I'm not going to lie to you.
I mean, I think Andrew was keeping a boob counter. Every time we said boobs, he wrote it down every once in a while.
Well, Andrew, no honking sound, Andrew? Yeah, that was the running joke before we started. But you've done this for 24 years.
Yeah.
You've seen it. You've seen a lot, from your trips overseas to the people that you've helped here to the women that you've helped with their self-esteem. Because we're coming to the end of this thing, and I like to ask everybody what your suffering in your field has taught you.
What it teaches you when you go through seeing so many lives being bust apart in so many different ways, and then being the person that can help put them back together again. I hope that it teaches the person doing it how to get people to the other side of it, right? I mean, because that's what this podcast is about too, right? I mean, it's about getting people to the other side. And again, if I have a friend who went to the operating room today, to have part of her uterus taken out. And all weekend long, she was just terrified of what they were going to tell her afterwards, you know? And again, I'm sitting there looking at her and I'm thinking, you know, I know what she's going through. I know exactly what she's going through. But I also know that on Monday, you know, she's going to get good news, she's going to get bad news. I think she's going to get good news. And it was good news in the operating room today. But I know that people get to the other side, you know, whatever it is. And whatever you have to do, you're going to do it. And then you're going to heal and you're going to get past it. And you're going to look back and you go, wow, I thought there was like just this locked door that I was never going to get past. And I know that all those people are going to get past it. And, you know, is that to say that nobody ever dies and nobody ever gets terrible news? Of course you do. But you know, you can get through things.
It's hope.
Yeah.
You gotta go in with a positive attitude, and you know, if you go in with a defeatist attitude, you're gonna be defeated.
I think that's what you offer.
And
more than your talents and more your reconstruction and more than your art ability, it's you give people hope.
Yeah. And so many people, so many problems are not as big as we think they're going to be. You know, I mean, there's that tiny percentage of really terrible things that turn out to be really terrible. You know, there's that small percentage. But we spend so much time worrying about what if this happens and what if that happens and what if that happens. And this is what I said to my friend, you know, last week is like, all these horrible things are going through your head. And then next week, you're going to find out the damn thing is benign. And you're going to say, why did I spend 2.5 weeks like making myself insane?
Wasted time.
Totally wasted time. Totally wasted
Absolutely.
Dr. Cohen, I thank you so much for coming in today.
My pleasure.
It was
This
an
is
absolute pleasure,
This
man.
is
Yeah,
fun.
we like I said,
We could talk for forever.
Listen. I'm retired. I got all night.
We could break it apart into different pieces of the work of boobs, but we do have to end sometime, and I do thank you for coming in.
Yeah,
This
my
is a big
pleasure.
one. This
My
is a big one. And that's going to do it for this episode of the Suffering Podcast. But as always, before we leave, we think about what we learned. There's a lot of terms for breast, and we tried to go through many of them here.
But the biggest one is boobs.
The biggest one's boobs.
My favorite.
We're going to say boobs.
That's third grade.
Yeah.
Boobs.
Quality of life is absolutely priceless. Umbilicus, right?
Umbilicus.
Umbilicus. Umbilicus is my new word. Umbilicus. I got to get that one. Reconstruction is way more than just cosmetic. But most importantly, we are so fortunate in this country, thanks to Dr. Cohen.
Yeah.
And that's going to do
you.
it for this episode of the Suffering Podcast, The Suffering of a Plastic Surgeon with Dr. Cohen. And as always, follow us on Instagram, Facebook, Twitter, and TikTok. Don't forget to follow the Suffering Podcast on Instagram. Follow Mike at Mike_Failace. Follow me at Real Kevin Donaldson. And we will see you on the next episode of the Suffering Podcast.